to showcase some of our facilities which are doing excellently. If you have time to visit the other facilities, you will see that they are also functioning very well as per the directives of our Honorable Prime Minister Shri Narendra Modi. We have a lot of support from the state government, our Honorable Chief Minister and our Honorable Health Minister also. So we could take most of our projects forward, and we have completed them. Like for example, the conversion of the health and wellness centers, the digitization of all records, ABA card generation. You all have seen. You have seen that we are going to put physiotherapy facilities in all our CFCs and some of our PHCs. So we are constantly striving to see that we are doing well and giving the best possible health care to all the people staying in Goa. Today we have with us our Secretary Health, Shri Arun Mishra, and the OSD and Nodal Officer for G20, Dr. Kumar. Of course, you have known him for the past 2 days, and we have his staff also from ABDA. So, if you have to ask any questions, you
we will ask our secretary to just brief in the beginning, and then we will just have a very short, very fast presentation by our Dr. Shweta. I will request our Honorable Sir, IS.
वेलकम डियर फ्रेंड्स, आप 2 दिन यहाँ हमारे साथ रहे गोवा में, कुछ गोवा के अपने फ्रेंड्स बाहर से आए हुए। आपने देखा होगा शायद कोल्ड फैसिलिटीज़ हमारी देखी होगी, यहाँ इंटीग्रेशन जो है हमने जो शोकेस करना था उसको एज ए ग्राउंड लेवल पे हमारा काम कैसे चल रहा है, अगर उसकी एक्चुअल रूप में कैसे डेटा ट्रांसफ़र हो रहा है, एंड टू एंड कैसे उसका चल रहा है, और वो सारी चीज़ें देखी होंगी। बेटर ये होगा कि आप अपने इनपुट पे कोई क्वेश्चन, कोई क्वेरी हो, क्योंकि हमारे 2-2.5 लाख आभा कार्ड जनरेटेड है, 25% हमने आभा कार्ड जनरेट कर दिए हैं, अराउंड 3 lakhs, और अराउंड 900 हेल्थ फैसिलिटीज़ हमने उससे मार्क कर ली हैं, और 900 हेल्थ फैसिलिटीज़ हमारी हो गई हैं। तो हमारा टारगेट तो खैर था कि हम अप्रैल में ही शुरू कवर कर दें, बट सिस्टम में थोड़ा सा टाइम लगता है इस्टेब्लिश होने में। तो बाई जून एंड तक हमारा ये टारगेट होगा कि 100% हम आभा कार्ड से अपना डिजिटाइजेशन कर लें, और सारी हेल्थ फैसिलिटीज़ PSC वगैरह को हम उससे जोड़ें। पोर्टली में हमने देखा होगा कि कैसे एक पेशेंट आता है, सबसे पहले जैसे ही अपना कार्ड देता है उसका सारा सिस्टम ऑनलाइन अवेलेबल हो जाता है। डॉक्टर कैसे एंट्री करते हैं, या फिजियोथेरेपी में हो, आयुर्वेद में हो, या एंड प्रोडक्ट आपका फार्मेसी में हो, वहाँ जाके दवा लेना एवरीवेयर। अच्छा, बीच में हमारी ये भी कोई फाइल लाइन आ जाए, सपोज करें फार्मेसी इज नॉट वर्किंग है, सो वी कैन जंप ऑल्सो, देयर इज प्रोसेस to break the chain and get the legality, because no patient will dependent upon the system, he needs medicine and attention. So we have that provision also to curtail the processes. So it can't be said that due to online process, if systems fails or the data system disintegrate, what will happen? So we will operate it manually, we will give the medicine manually. Systems are there, and system will not hamper our process, the actual work, the delivery of the medicine and treatment. Thank you. Any question if you want to ask, or rather question we want to share your experiences with us, because you experience much better than what we are projecting or what we are saying. I request you to just come forward, tell us your view and how we will improvise further better.
सर, एक ही और आप आभा कार्ड बना रहे हो, पर कई एरिया पे टेक्निकल प्रॉब्लम्स है, लाइट्स, जनरेशन से एवरीथिंग प्रॉब्लम्स है, उसका क्या सॉल्यूशन है?
सॉल्यूशन बड़ा अच्छा उसका निकाल लिया है। देखिए, हम जीरो कार्बन एमिशन नाम पे आ रहे हैं ना, आपको तो देखा ही होगा, आप रिपोर्टिंग कर रहे हैं। आज ही हमने मीटिंग ये भी की कि हमारे 25 PSC, तो हम वहाँ सोलर पैनल लगाने का हम एक प्रोसेस शुरू कर रहे हैं। तो उसको लगाने के लिए व्हाट इज आवर प्लान, हम स्टडी करेंगे पर PHC में व्हाट इज द पावर रिक्वायरमेंट, करेक्ट। उस पावर रिक्वायरमेंट पे 5 साल प्रोजेक्शन, वी विल गो बाई 5 ईयर मोर प्रोजेक्शन, पावर डिमांड इंक्रीज होती है जिन, उसके बेस पे हम सोलर प्लांट इंस्टॉलेशन करेंगे। तो वो हम आई होप कि 1 साल के भीतर जो है लोकल नीड को भी हम मीट आउट कर लेंगे, उसका ग्रेडेड भी होगा, उसके पॉइंट भी हमें मिलेंगे कि हम रिटर्न रेट में सप्लाई करेंगे पावर। तो दैट इज बेसिकली पावर इशू, बट प्रिसाइजली आंसरिंग योर क्वेरी हाउ इट विल बी डन। नंबर 2, द डेटा प्रोसेसिंग इशू। Government is committed to provide the proper network facility to each and every PSC and every nook and corner of the country or particularly the state. So we will be in position to tackle it. यहीं पे मैं आपको बताता हूँ जहाँ कोडिंग है, nobody will share that because we are showcasing our achievement. We didn't want to hamper or put in a bad light. So we have managed 3 line of systems. एक तो आपका BSNL का सिस्टम है, एक हमारा पर्सनल का जो यूज होता है वो भी आपका सिस्टम है, और एक थर्ड सिस्टम जो हमने प्राइवेट डेवलप किया था. मेरे कहने का ये मतलब है कि if you are deciding that it will be done, then it will be done. जो आप टेक्निकल इश्यूज कह रहे हो ना काम करने के हो सकते हैं, यदि आपको करना है तो it will be done.
Just to add on to whatever sir has said, we have got biometric devices also. Biometric devices are there in place. Initially we had taken a few biometric devices. Now we have bought in more 30 biometric devices where just the thumb is again integrated with the ABA thing. Once it's done, it's a much more faster process of getting the ABA ID generation for the patients. So that is happening. And as sir has said, we have got a GBPM connection, we have got a private players connection, Ethernet connection, and the local Wi-Fi systems also in place. So that whenever there is any issue of NAC connectivity or anything, there is a backup connectivity issue is sorted out. So right till date we have generated 3,85,000, closely 4 lakhs ABA. So as sir has said, probably by June, July, we will try to complete the remaining ABA that is required. A population of God is considered 15 lakhs. We will achieve that targets in due course of time.
Just madam added that 5 PSCs are already solar power enabled. So we are looking forward what you have raised your question in that direction, working.
और डॉक्टर केदार, जैसे आपने कहा कि जो जितना भी गोवा की पॉपुलेशन है उतने आभा कार्ड्स बनाने का आपका प्रयास रहेगा, पर दूसरी ओर देखा जाएगा कि कुछ लोग ऐसे हैं जिनको अभी तक मोबाइल यूज करना भी नहीं आता है, उन लोगों के साथ आप कैसे कर सकते हो?
Yes, good question. Our health centers, health facilities are there. We will be having the different staff of the health centers trained. So in case they don't have, we will be using our mobiles and other systems, and we will be generating those ABA numbers for them also. At some places in remote areas, these issues were coming up. We are in the process of sorting out those issues also. But as you said, some person does not having mobile. In that case, some other alternative mobile would be used, and we will generate an ABA number for him also.
Sir, I'm Himali from CNNNewsReview.com. We have come from Delhi actually. So yesterday and today we have visited PHCs and we were really very happy and appreciate some of the initiatives taken by the state government. Just to hear from your mouth, I just wanted to understand if you can recall any 1 or 2 initiatives that are unique to the Goa state government that you started.
Yeah. I think our director will speak on this.
The latest initiative, which I would say in the wake of COVID, is the genome sequencing laboratory, which we have in our district hospital North Goa, which is ICMR recognized, INSACOG recognized, and there is no such facility in any district hospital in the country, as far as I know. So this is one initiative which we have set forward, and we have got recently INSACOG approval also.
INSACOG approval, this means it's the part of the INSACOG network.
It's part of the ICMR laboratories network, and probably the only district hospital, along with South Goa District Hospital, which are there in that ICMR.
Just to add on what ma'am has said, just to add on the state initiative which you have seen yesterday. A few of the initiatives of our honorable health ministers, which I would like to bring to the forefront, is one of the STEMI project, which we are doing very well. More than 2,500 lives have been. This is a flagship program which was initiated by the government of Goa, by our honorable health minister, which has got a lot of publicity at the national level also. That is one of the programs which we are doing at. Apart from that, we have got something called iPress program, wherein we are supposed to do the scans of over a lakh of ladies all across Goa. So till now we have done around 65,000 scans. Again, an initiative by our honorable health minister, which we have done, and which we are having a few results. Out of those odd 2,000 lumps which we have detected. We have around 25 to 26 ladies positive for breast cancers. So these are the few of the initiatives. Apart from the pediatric programs are there. Then we have got diabetes programs. Then we have got hypertension initiative programs. So a lot of programs are there. But these are the few of the initiatives which the state government have taken.
मॅडम आता तुम्ही बोलला जिनोम सिक्वेन्सर बोलला ना त्यामध्ये लिमिटेड टेस्ट केल्यानंतर उरलेल्या टेस्टसाठी पुण्याला पाठवायला लागतात का त्याच्याबद्दल काय
See, the capability of the lab is the processes take a very long time. The sequencing takes nearly 6 days or 7 days. एवढे दिवस लागतात त्याला. So if there are a lot of cases, then only a sample kind of cases, those people who needed admissions, those people who are critically sick, yeah, all of those people who have expired, unfortunately. So only these people, if there are a lot of cases, then it is not possible to test every single case. So at present, since the the cases are down, we are testing most of them.
What is the capacity here in district hospital North Goa?
Azilo, it is 24.
24 samples.
24, yes.
Samples a day.
Yes. Samples of
We will try to take the questions
it
of.
takes 1 week.
Dr. Keeler, I just want is STEMI linked to all the health centers or it is available only at select?
Which one?
STEMI program.
We have got designated health sectors all across Goa. Yeah, we have got around hub and spoke models. So around 18 the presentation is there, which will show you to you here. Yeah.
These are the achievements.
These are the achievements. So yes, health centers are around 18 hubs. 20 spokes are there, and there are 3 hubs. So these are the achievements. We have got total number of STEMI diagnosed were 3,425, and patient who had thrombolysis. Mind you, all this drug is very expensive. Again, a state initiative. If you want to buy it at a wholesale rate, cost 22, 23,000. So again, a very state initiative by our Honorable Health Minister, and it's given free of cost all across the STEMI spokes across Goa, and so many lives have been saved because of this. These are the steps involved in the patient. Once the patient comes to the health center and how the patients, all this write-up we will put it on a pen drive and give to you guys.
One very important point what Dr. Saab has suggested and told you. The golden time is 90 minutes for these type of cases. In normal Indian average is 4 to 6 hours. Dr. Saab will answer it. But in Goa, after launching this scheme, we are in position to reach and every patient within 2, 3, 5, 10 minutes after the call to GVK. So it is a great achievement by our this model.
And we have got good testimonials of patients how their lives were saved. And those testimonials are good enough to make us very proud as to what we have done for the states.
Okay.
Yes, ma'am.
Alka Aryan, independent journalist from Delhi, and my question is to sir. Okay. As Goa prepares for G20 Health Working Group, and we have seen some of the best primary healthcare services yesterday and today, how do you plan to share these positive examples with neighboring countries?
We want to convey that we should showcase to G20 dignitaries also. So we are planning and suggested Government of India to showcase our model, particularly told him in other 5 PSCs and other 5 PSCs where there are solar power independent system is there. So we have requested in the G20 teams will visit to the PSC so that we can showcase it. And you might have heard in the paper that the Bill Gates Foundation and others also requested to showcase the digital transformation in healthcare center in India. So that may be chosen for that.
I have some small question also, that's all. Because now you mentioned that you will fulfill your target to make ABHA by June or July. Okay, and my concern is about infants. Okay, matlab, what's your planning to make ABHA for newly born children?
मैं आपको बताता हूँ मैम, we are modeling for a very successful model. I am just digressing for your main question, then I will come back to your question. In nationwide, there is one problem: stunting, wasting, underweighting, and other issues. So what we decided in Goa, that every married couple will be tracked by us after getting the marriage registration certificate. Correct? We will approach them, we will check their blood. We are putting a system in place. Within 6 months, I think we will be in position to put the system in place. And then we will track every newly wedded couple, whether they are enemy, what are the problems, so that no child will born with some infirmity. Not if it is separate issue, but what we can maneuver, what we can manage, that will be done.
To add on to what sir is saying, we are having something called CoWIN portal or any other
Yes.
things. So all these portals are linked with ABBA. So as soon as the child is born, again,
That will be linked
those will be linked through for the ABBA
Our
generation,
generation.
generated from there.
Automatic mode. Automatic mode.
Yes.
Ma'am,
Yes, sir.
G20च्या पार्श्वभूमीवर तुम्ही जो आरोग्य
सर आपकी
सेवेचा
बात सर इसके बाद आएंगे मैम का ग्रुप आ रहा था क्या इसके बाद सर आपका
So I'm Sumitra from Times of India, Mumbai. I had a question that there is a, crisis, you could say, of specialists across the country. There is an imbalance in doctor-patient ratio of specialists. So do you see this technological, this AI-based interventions like STEMI somehow bridging this gap?
Yeah, certainly.
Yeah,
And that is a very unique but negative example. I'm telling you, Government of India is sending so many letters to us. Why your telemedicine conferencing is not so popular? But here in the position that we are in position to reach out each and every patient within no loss of time. So this our system is working well. But anyhow, we are working on the teleconferencing issue. We are not negating from the Government of India's direction. But our successful model shows that teleconferencing rate is very growing.
The doctors for STEMI project, they revert back in a minute's time. So once the patient is, whether he's having myocardial infarction, we can come to know in a minute's time, and then the patient is immediately thrombolized based on the reporting.
Within 5 minutes, ESG is monitored by in Bangalore and reports came.
Immediately that happens. So, yes sir.
नहीं कॉम्प्लेन बोला था मैं पीछे
हा मॅडम
हाँ.
G20च्या पार्श्वभूमीवर तुम्ही जो आता आरोग्य सेवेचा आढावा घेताय, मीडिया टूर करताय, प्राथमिक आरोग्य केंद्रामधल्या सुविधा तपासताय, G20 परिषदेनंतर सुद्धा हा प्रयोग तुमचा चालू राहील का?
See, this is about the IPHS standards. You can find out. IPHS standards.
Indian Public Health Standards.
Indian Public Health Standards are there for the primary health centers, community health centers. And he facilitates if you check, I'm not telling you that they are all there. You check what facilities are there in each of our institutions, and you will find that we are compliant. Plus, we are having extra facilities for आमच्याकडे like for dialysis facilities. You can ask any of your colleagues here, and you'll see that the dialysis facilities are not there anywhere in the primary health centers in the other
states.
This is what I was told by the team which came for the national level certification. आता we are a literate population. We expect quite a lot. आमचे district hospitals, secondary hospitals. If you check with the IPHS standards, of course we have a shortage of specialists which we are trying to address in all ways possible, which is not only here, it is a national problem. But what we are doing all efforts, the advertisements are going, and thus we are finding ways to take these specialists on contract. As of now, nobody is suffering because our people are working, all the doctors are there, and plus born doctors are posted from Goa Medical College to our district hospitals, and all the facilities are available. I tell you to check the facilities against the Indian Public Health Standards. The GMC is a tertiary hospital, whereas our district hospitals are secondary hospitals. So I was told even in SDH Ponda, when the national certification team came, that we have a lot more facilities than other sub-district hospitals in the country. So we have a lot of facilities. Still, we are trying to give more. We are giving free medicines, free insulin, DDSSY scheme is there, Mediclaim scheme is there, by which we have to say that every Goan is fortunate. It is not that we are doing it, then whatever is there is showcased only for G20. Maybe there are one or two PSCs which need more facilities, and which we are working on an overall plan for the state of Goa to see that the any place which you require is strengthened. Our peri-urban areas are also turning urban areas. like many of the villages, you know, they are mostly urban, though they are called villages. Here we need more facilities. So all that we are doing charting, and probably in 1 or 2 months time, we'll have a vision for the state of Goa. And it will not be dependent on the national norms. National norms are there in the Indian Public Health Standards. And we are doing far more than that, but still we will do even more.
मैम आप let her ask.
Madam ask.
She has to take the flight. अच्छा please.
So hi, I'm Shreya. I'm an RJ with Radio Mirchi, and I have been very impressed with the health facilities that I've seen for past 2 days. I've been to 4 primary health centers, and I would really like to congratulate the state government and everyone who is, trying to build a very healthy, Goa. I have a very basic question here. I feel that right now people are getting aware, but when most of the people will get aware of the facilities that you guys are giving, for example, the kidney facility, the dialysis, the physiotherapy, are we prepared with the staff and the machines to deal with more and more people?
I will tell you, ma'am, you have asked a very prepared question for me. And I have very peculiar fact about this.
Okay.
What is the population of Goa? 14 lakhs around.
So 15 lakh.
How many people visited the public health facilities, government health facilities in Goa last financial year? Can you guess? Footfall, change the person footfall. 18 lakh footfalls recorded in the Goa public health system. 18 lakh out of 40. It means some people stayed twice, 4 times, 7 times. It means our reach is impeccable. Everybody is so confident about our system. Without losing any time, they visit, and we are there also. We are in Sankli, we are in Kankona, you have visited that place. We are at Korlem. I am telling you one fact. Just appreciate the system. One of our senior officers required some mental help. He asked me, being a secretary, help. He just helped me what to do. Don't worry, sir. Just dial 108. Every help you will provide. That the senior officer dialed 108, and within 3-4 minutes, package reached at his residence. Some injection were introduced, given, injected. So I think reach is very good in Goa. What I will suggest that whatever my friend from Goa asked, that whether it is the Sukhesiva G20 or not, or it will be sustainable or not, I am telling very frankly, I walk in Delhi, I walk in so many places. Hiding in Goa is the most difficult thing. Goan people don't hide anything, they are very transparent. If it is not there, they will say, no, this is not. Just man say, there something is there. So we have nothing to hide. Whatever it is transparent, you can move anywhere, anywhere.
Sir, my question is that you said about the ambulance. Even in Goa now we are facing the issue about ambulances that even if we call 108, ambulance take 30 to 40 minutes to reach on the spot due to some traffic issues or other issues. So how do you say that?
What you suggested, I will take your number and I will check the call log and I will revert you.
Yes,
this is
sure.
a very factual question it is. So we will check when the call made and when the vehicle responded, because there is time log maintained by the GVK of the private company. So ma'am, we will reply to him factual.
Yes, sir.
I was damn impressed. I'm Madhurendra Sinha. I'm a senior journalist from Delhi. I work in many groups, Times of India, etc. So I was very much impressed with your analysis facility, of course, this SPMI. Now I have a little confusion or question in my mind that India is the pioneer country in the world in the sector of IT. So how are you using I saw that you are using it quite fast, but are you matching it the speed with which we should do it?
What you are suggesting that whether we can manage the speed initiated by the government of India or Honorable Prime Minister regarding the digital health system. In Goa, yes, we can meet it. See, we have reviewed in December. We targeted for April to complete it. Before G20 we want to complete, we wanted to complete it, but somehow we could not get through. But today 2,50,000 ABHA cards issued, 900 health personnel listed there.
Health professional.
Health professional registries are there.
3,85,000 hours.
Yeah. So you know the initial problem is the teething problem. Once the system is settled, now system is settled, going well, so we are in a position to get it done by June, July. We are not giving a very high target and thinking that we will do it. But 3-4 months, I think.
Your question was pertaining HMIs rolling out now. Since the whole for the state of Goa, the whole proposal is in the pipeline with the state government. So we are just waiting for some clearances. Once that happens, HMIs and Ayushman Bharat Digital Health Mission will be rolled across public health sectors at the level of primary health centers.
Sir, please can you repeat the number of the ABHA card? Is
आज तक मैडम 3,84,000 और कुछ था.
Close to 4 lakhs.
3,84,85,000 कुछ है.
मैं बता रहा हूँ 290 to 9.
Around 3,84,85,000.
It will be there on the ABM app.
अभी 2 मिनट में बोलते हैं.
1 मिनट बता दो.
I hope the national, I mean, we had a mix of both local as well as national this. I would request any of the national person in place to just give a feedback as to what was the experience for yesterday and today morning. In case someone can, yes, yes ma'am, please.
So I'm from radio and we generally deal with a lot of entertainment. But for the first time, I was given the task because we keep talking to people on radio and keep making them aware. And for the first time, I was, in Goa for work, and it was very impressive. I was telling my colleagues, and I will go back and tell on my show that I haven't seen such a model yet. Wherein, सबसे बड़ी बात, it was very clean. We will definitely talk about the facilities, but the moment you talk about government hospitals, a normal person would not like to even sometimes, think about it going there. There is a peculiar smell, there is no cleanliness. First of all, it was very clean. The other thing, the very expensive facilities that you guys are doing, whether it is thrombosis, whether it is kidney, it is, I think that it should be replicated by the other states as well. I don't know why they are not able to pull this off. But you guys are setting an example.
Thank you.
From local media.
Any person from our local this?
We should strike a balance between local and
आता तुम्ही सांगा ना. कोणतरी तुम्ही काल गेलेले बघा. तू सांग कसं तुझं काय एक्सपिरियन्स होता?
कॉंग्रॅच्युलेट गोवा गव्हर्नमेंट, कारण जे बजेटचा 80% जो पार्ट आहे तो हेल्थवरती हे करतोय. दुसरी गोष्ट म्हणजे ग्रामीण भागामध्ये जसं खोर्लेम PHC आहे त्याच्यामध्ये एवढा चांगल्या सुविधा उपलब्ध करून दिल्या. जसं आपण म्हणतो की PHC म्हटल्यानंतर किंवा ग्रामीण भागातले रुग्णालय म्हटल्यानंतर आपण म्हणतो की फक्त जायचं, तपासायचं आणि यायचं. पण त्या ठिकाणी ज्यावेळी ग्रामीण भागातल्या लोकांना अशा प्रकारे सुविधा मिळतात आणि ह्या सुविधा आपण फक्त म्हणतो की काही झालं की GMCला जायचं, पण नाहीये. पण ज्या पद्धतीने ग्रामीण भागातल्या सुविधा उपलब्ध करून देत आहे, खरंच एक लोकांसाठी तिथे एक चांगली सोय आहे.
Sir, can you translate? Sir, can you translate in Hindi or English?
क्या मैं हिंदी में बात कर सकता हूँ?
नहीं, हमें तो
ओके. जैसे हम गोवा में बोलते हैं, जैसे हम गोवा बोले तो खाली हमें GMC लगता है, बट गोवा के जो रूरल एरिया का जो, जैसे हम कल खोरली में गए थे, वहाँ में जितनी फैसिलिटी लोगों को दी जाती है, जैसे अच्छी सी यानी हम बोलते हैं कि जो PHC बोलते हैं या जो गांव का हॉस्पिटल बोलते हैं, वहाँ पे खाली जाने का और खाली मेडिसिन लेके आने का, बट वहाँ के लोगों को जो फैसिलिटीज जो गवर्नमेंट ने प्रोवाइड की है, जैसे हमने देखा है कि अच्छा यानी एक 5-6